Hello everyone and welcome to another of our Facebook Lives. My name is Zoe Clark and I'm Self-Management Programme Officer here at NASS, and today I'm joined by Phil Bateman, who's a physiotherapist. So thank you for joining us, Phil.
Hiya.
So today we're going to be talking all about jaw pain and Axial SpA or AS. So we're going to have this little introduction and then we're going to have a presentation from Phil and then we'll go into a Q&A. So please do pop your questions in the comments box and we'll come back to them in the Q&A session at the end. So firstly, Phil, would you like to say a little bit about yourself for everyone watching?
That's fine, thanks a lot. So just to introduce myself, I'm Philip Bateman. I'm a physiotherapist. I work for Sheffield Teaching Hospitals Trust. And I'm mainly based in the musculoskeletal outpatient department. And enough, all my referrals that come to me are either from the dental hospital or from rheumatology. And it's patients with a working diagnosis of what we call temporomandibular disorder, which is a jaw problems.
Brilliant. Thanks, Phil. So really pleased that you're joining us. Some people may have seen your presentation at Physio in Focus, and we got loads of great feedback from that. So glad to be able to bring it to more people today. Brilliant. So we'll go ahead with the presentation then, and then we will do the Q&A afterwards. So I'll just make sure that I can share my screen and get that all up there. This is the bit with the technology. Okay, perfect. So hopefully everyone can see that, and I will mute us.
Hello. Today I'm going to talk about temporomandibular disorder, or TMD, and axial spondyloarthritis. My name is Philip Bateman. I'm a physiotherapist and I work for Sheffield Teaching Hospitals Trust. I'm mainly based in the outpatient department at the Royal Hallamshire Hospital. And most of my patients come from either the dental hospital and some come from the rheumatology department. I'm going to try to answer two questions. First question is, what is TMD? And the main focus will be on TMD and axial spondyloarthritis. The second question is, how is TMD treated? And the focus will be on education and physical therapy. So I'm starting with a simple definition of TMD. This is a term used for a number of clinical problems that involve the jaw joint, the jaw muscles, and the jaw joints. Another name for the jaw joint is the temporomandibular joint, or the TMJ. What is the cause of TMD? Well, TMD can be associated with multiple factors. Common driving factors include facial trauma and daytime oral habits, such as nail biting or clenching the teeth during the day, sleep bruxism, which is clenching the teeth at night or grinding the teeth at night, poor posture, and emotional stress. These factors can increase muscle and joint loading. The prevalence of TMD in the general population is around 30%. That means that 1 in 3 of us at some point will have symptoms of TMD. Uncommon driving factors also exist, and one of these is systemic arthritis. So TMD can be associated with axial spondyloarthritis. Reported incidence of TMD involvement in AS has been disputed, varying from 4% right up to 35%. Current thinking is that axial spondyloarthritis patients who develop TMD symptoms are far more likely to have two separate conditions. In other words, their TMD symptoms are not associated directly with their systemic arthritis. Early diagnosis and intervention helps prevent development of persistent symptoms. And TMD is usually assessed by a rheumatologist, a dentist, a GP, or the patient's physiotherapist. What are the symptoms of TMD? The patient will experience pain and tenderness over the jaw joints and or the jaw muscles, pain aggravated with jaw activities such as chewing, biting, and talking, limited mouth opening, joint sounds such as clicking and creaking of the joint. And if TMD is attributed to axial spondyloarthritis, patients may experience other symptoms. Jaw symptoms may worsen with exacerbation of other systemic symptoms, and there might be signs of temporomandibular joint inflammation, such as swelling, redness, and increased temperature in front of the ear. Second question, how is TMD treated? Well, guidelines for safe and effective treatment include use of conservative evidence-based treatments, and the main treatments would be education advice and optimum medication. And if the TMG, the temporomandibular joint inflammation was involved with axial spondyloarthritis, this would be via the rheumatologist. Other treatments would be physical therapy, splint therapy, and psychological support for those who need it. I'm going to focus on education and advice and physical therapy. So patient education about the disorder is crucial. So when patients come to see me, I'll be using a skull and images to help reinforce their understanding. This will help patients make sense of their disorder, reduce the threat of their symptoms, and help provide a rationale for treatment. I'll also be providing patients with information leaflets, and this will provide advice. And the main thing we want to be looking at initially is what is the normal jaw rest position, as we want to avoid jaw habits such as excessive tooth contact, which cause muscle and joint loading. So we'll provide a reference point for normal rest position, and this includes a short exercise, and the main aim is for patients to remember to keep their tongue up and teeth apart. We also want patients to avoid prolonged forward head posture in sitting, because this will also include muscle and joint loading. So the main advice is don't sit for long periods without a break. Other ways you can reduce stress and strain on your jaw, joints and muscles includes eating a softer diet while we're treating you, chewing slowly, and trying to avoid caffeine, which is a stimulant and can increase jaw activity. We also will teach a different way of yawning to initially stop the patient from overstretching their jaw, and want to avoid certain aggravating or loading postures. And if your dentist has provided you with a splint or bite appliance for your sleep bruxism, we'll be encouraging you to use that. And if the GP or the rheumatologist has provided medications, we'll encourage you to be taking your medication as prescribed. Also, regular daily exercise is very good for physical and mental health. We can provide strategies to reduce unhelpful jaw habits. One of these strategies is the use of the oral behaviour checklist. So looking at this list on a daily basis for a week and then trying to fill the frequency boxes in at the end of the week will help us find out what your driving or contributing factors are. So by the end of, after we've provided the advice and looking at the oral behaviour checklist, you'll be able to identify your own driving factors. And then we want to minimise these driving factors, and this will help to break your cycle of pain and get a better balance in the system. Another strategy to help you do this would be using something called the No Clenching app. This app will alert you to check that you're not doing your oral behaviours every half an hour or every hour. It will also alert you to check whether you have a normal rest position and to take a break from sitting. Next, we're going to look at some physical therapy techniques, and this will be for muscle tension. We want to try to reduce muscle tension, and the various ways we can do this include jaw relaxation techniques. We can provide various massage techniques to the patient to help relax the muscles and reduce pain, and send them away with exercises, particularly for the big closing masticatory muscles such as the masseter and the temporalis. For poor jaw control, we can provide various exercises to help improve jaw control. For joint stiffness, we can do manipulative therapy techniques to the patient and give them exercises to help restore temporomandibular joint mobility, and none of these techniques should be excessively painful. If symptoms don't improve, which is very rare, as TMD is a dental specialism, patients might be then referred to a dental hospital for further assessment. Also, they may undergo further investigations either by their rheumatologist or the dental hospital. And management should involve close communication between the various clinicians, particularly the rheumatology department and the dental hospital. So hopefully I've outlined what TMD is and how TMD is treated. Any questions?
Pretty well. Thank you for the presentation, Phil. That was really, really interesting, and hopefully giving people lots of advice on what TMD is and what they can do to help with it as well. So we're going to go to the Q&A session now. So we've had lots of people watching live. So for everyone watching, please do pop your questions in the comments box, and we'll be able to get around to answer them. So we have already had a few questions coming in when we were advertising the post, so we'll go through those first. So one of the first questions was asking about jaw pain and TMJ pain and how it can mimic toothache. Do you have any advice if someone's getting pain, whether they can tell if it's sort of coming from the jaw or from the teeth? Is there any quick tips you've got?
Yeah, so well, I mean, I'd always advise a patient that has jaw pain to initially go for an assessment with their dentist. As I said in the presentation, temporomandibular disorder is a specialty that's under the dental. First, initially by a general dental practitioner would be the best person to see, and they'll be able to assess the actual dental side of things and the jaw joint itself and the muscles.
Okay, excellent. And we had Jason asking about his jaw has started clicking, and he was wondering if it's something he should be worried about. So this is quite a general question.
Yeah, no, that's fine. Yeah, so jaw clicking, I first want to say that it's really common, and it's related to one of the classifications of temporomandibular disorder called a disc displacement with reduction. A nice posh term for what it means is that the cartilage in between the joints actually tends to slip in and out of the joint, and about 30% of the population probably have this, so it's more of a kind of a norm in the population than an abnormal thing. But just because it's very common doesn't mean to say that you don't want it maybe to be assessed by your general dental practitioner, just to make sure that he's happy with that. Usually the noises from the joint, if it is the cartilage clicking and back, it's quite consistent. So every time you open your mouth and close your mouth, it tends to occur somewhere between midway, opening and closing. But your general dental practitioner can assess for that.
Okay, excellent. And we had Diane and Kathy both sharing with us in the comment section that they've both had jaw pain on both sides after a dental checkup. They found that using heat locally and using Voltarol, like an anti-inflammatory gel on the area, helped. Is there anything else that you'd sort of advise, anything that could speed up just settling down any pain there?
Yeah, so no, that's good. Another good question. So I'd suggest before your actual dental appointment, there's probably a few things that might be able to be put in place. If you advise the dentist that you do have a problem with your jaw, they can arrange to make the appointment a bit longer, so you can have breaks, which is very useful, so you don't have to have your mouth open for such a long time. And there's also something called a dental prop that they can use, and they can put this between one side of the teeth while they're working on the other side, really, and it allows you to rest your jaw on that, and that can be quite helpful. Afterwards, just as you said, the Voltarol gel, heat, and even for some people ice is helpful, and pain medications can help to reduce the pain. And then maybe the next day, or as it starts to settle, maybe some gentle massage, and maybe that control exercise that I showed you earlier can calm things down a bit further.
Oh, excellent. That sounds really good as well, that you can be proactive about it and do some things to hopefully prevent it happening, or make sure that it's less severe. Yeah,
Really important.
brilliant. I'm sure that'd be really helpful for them. And we've had, this is a more specific question from Michael. He was asking about, he's got jaw pain and neck pain that are sort of traveling up into his head and giving headaches. I imagine you won't be able to give specific advice. It might be that he needs to see a physiotherapist, but is this something you commonly see?
Yeah. So, and there's many causes for jaw pain, neck pain, and headache, and obviously they can all happen together. And often do, and often are associated with one another. But my advice really would be initially to get some kind of assessment, and I would probably start with my general medical practitioner, because it's covering a fairly large area, and they are good at general assessments as a starting point. If they think it's more related to the jaw, then going on to your general dental practitioner would be a good start. If they think both the dentist and the general medical practitioner think it's muscle or joint related to the jaw, then certainly a physiotherapist to treat the neck and the jaw would be fine. Yeah.
Okay, excellent. And you touched on this a little bit in the presentation, but I know we discussed last time we had a chat in preparation for this, we were chatting about whether the jaw actually gets inflamed in the joint itself for people with Axial SpA. Do you want to just share what you shared with me about that?
Yeah, so we know that SpA can affect peripheral joints, which are joints beyond the actual spine itself, and that includes the temporomandibular joint. And the reported incidence, when I looked at this, is it varies kind of between 4 and 35%, which I thought was up to 35%. I thought was quite high, particularly for the inflammatory association with the problem. But we're looking at the study a bit closer. The methods that you use to assess and examine were really quite insufficient, really. And the current thinking is that most temporomandibular joint symptoms are not directly related to the inflammatory process of the AS. And there's not usually any evidence to associate the patient's systemic inflammation with the temporomandibular joint symptoms. So they're probably two separate conditions in terms of that. However, because people can, if they've got quite widespread pain, they can become a little bit more tense around the jaw. So that kind of indirect relationship can be possible. Yeah.
I think that's actually really, really reassuring for people with AS who may be watching, if they're getting jaw pain, because then it means that the things you've been discussing, the exercises and massage, are all things they can do to help with that, rather than it being from the general inflammation.
Yeah. And that'd be for most people, I think.
Definitely, yeah. And you've kindly shared lots of resources with us, which I'll be popping on our website with this video later on as well, so people can look back and they can go through those exercises. But we could go through some exercises now just to demonstrate for people, and if anyone watching at home would like to join in, obviously be careful if you've already got jaw problems, but it would be good for us just to try some out. I'll be your patient and
yeah, sure. I can imagine you're having. So initially I'd be probably what's more important than the exercises, just to point out really, is getting a good explanation about what the problem is. And we've talked on that in the presentation. And advice on how to reduce load on the area, and particularly about the normal kind of rest position of the jaw. So we know that one quick exercise to try to get used to putting your jaw into the correct rest position is to place the teeth. They should be slightly apart, about 1 to 2 millimeters. And if you say the word Emma at the end of the word Emma, you should have a 1 to 2 millimeters gap. So go on, Zoe, let's have a look at
Emma.
I can see that 1 to 2 millimeter gap. Very good. And then the tongue should usually, with most people, be on the roof of the mouth in what we call the clucking position, or the N position, and that kind of gives it a bit of stability in the lower jaw and allows the other muscles to relax better. So you make a cluck sound. Where you make that sound, your tongue usually sits just on the roof of the mouth, just behind the top teeth. So knowing that's quite important. And then you can, I would usually suggest to people for about a week or so, just to check on that position every so often through the day and correct it if it's not the case, if they're at rest, of course. And then go on to maybe use the oral behaviour checklist and maybe the app to monitor other various habits. And then we've got relaxation techniques, which we discussed. But the two techniques I'll try to demonstrate are the massage and the control exercise. So starting with the massage, we want to try to reduce the tension in the big muscles, because that'll take some of the pressure off the joint as well as the muscles. So if you think about my jaw line at the back, as it comes down from my ear and then goes forward, we call this the jaw angle, or mandible angle. And just above there, we've got the muscle belly of the masseter. So if you place your fingers over that area on both sides and clench, you'll feel the muscle belly, and you can see yours contract there. And all that you do is place the fingers over the area. You don't really need any creams or anything. You just place the fingers over and use the skin to massage the muscle below. And it's just a circular massage. And we know this works really well. It just reduces the tension and desensitizes the muscle as well. And there's that nice smooth interface between the two areas. And we suggest starting off about 1 to 2 minutes, then building up to about 5 minutes 3 times a day, and that should hopefully give a nice relaxation effect through the day. The other exercise is a control exercise. We know that people that have jaw problems usually have poor control around the jaw. So this exercise, you place your tongue on the roof of your mouth in that cluck position again, and the tongue remains on the roof of the mouth throughout the exercise. And what that does is help to actually stabilize the jaw a bit and keep it back a little bit, and just allows what we call the hinging of the jaw. So a nice, simple, easy movement, and not usually painful for most people. And it also doesn't allow you to go past about midway of opening. So, and you open very nice and slowly. So what it should look like is as they open and closes. And this is called they call this the goldfish exercise, so you can imagine why. Really.
Yeah, those exercises looked really good. The massage felt really relaxing as well. So I can see how that would be nice. I mean, even if you've not got jaw pain, if you're in pain and feeling quite tense, you know, particularly at night, I think that would be quite a nice, just general relaxation technique. Take your mind off things a little bit as well.
Yeah, we know that a lot of people get tension throughout the day in the jaw. I mean, I know when I've seen a few patients through the day and they go home, my jaw will be tighter. And if you've got a jaw problem on top of that, then it'll contribute to the problems.
Absolutely. It's a bit like when you get to the end of the day and you realise feels like your shoulders are up around your ears.
Yeah.
Okay, fantastic. So I think we've covered all the questions that people had sent through beforehand. So I'll just go through the questions on the Facebook video. At the moment, I can't see any, but I will check on my desktop as well and just be sure, because sometimes my phone plays tricks on me. Did you have any extra information you wanted to share, or any other common questions that you get?
Yeah, well, I think it's just where you find help really is the main thing. And I'd advise people to really, if they think they've got a jaw problem, is initially go to their dentist. And that's really to assess, to exclude other causes. And we know dental problems are the main cause or the most common cause for jaw pain. And that's the initial thing you want to try to assess for, really. Once that's been excluded, then your dentist obviously can look at the jaw muscles and the joint to check on that. And then the dentist can initiate some treatments, which might involve exercises, advice, education, and then it may be a mouth, what we call a night splint, that for people that tend to maybe Brooks, which is just clenching the teeth at night or grinding the teeth at night. Now, if pain persists beyond that, they may get a physio involved, and particularly for more persistent pain, the dentist can refer you on to more specialists like dental hospital, to have a look at it and assess it in a little bit more detail.
It's good to know there are lots of places you can sort of go up depending on sort of what help you're needing.
And if you haven't got a general dentist, you can go to your GP also, and hopefully they'll know something about it anyway.
Excellent. So as I suspected, we do have some questions that have come in. We do have Mark's asking where we can get the oral behaviour checklist. I think that was in the information you sent over to me.
Yeah,
so I can pop that on our website.
Yeah, you can pop it on the website, and also you can get all these things from the Sheffield Teaching Hospital website. They're all handouts. That will have both the oral behaviour checklist on one side and details on how to get the no clenching app on the other side.
Oh, fantastic. We'll share a link to that afterwards, pop it in the video description. And Penny's asking, does the jaw actually fuse, as I have limitations in jaw opening? She's had problems before and she's on an anti-TNF, so the biologic medication. Do you know if the jaw can fuse in AS?
Very, very rare. So if you do get inflammatory changes, if one of the rare cases, then stiffness is kind of a norm, isn't it? Not necessarily fusion. I think fusion would be very rare. I'd like to reassure her about that. But the thing is, if she's not, like if she wants further reassurance, she can talk to a rheumatologist or a GP initially.
Absolutely, yeah, that is really reassuring to know it is very rare. And yeah, I'm sure the rheumatologist would know, looking at the bigger picture for each patient as well. Sort of.
Most patients that are most of my patients will come with restricted movements, and it's not due to things like fusion, muscle tightness and a bit of stiffness in the joints.
That leads us on to the next question really nicely. Mark's asking about, he does have jaw pain and he's been taking anti-inflammatories, but he's saying that he can open his jaw just enough to fit a cherry tomato through. He said, sort of, how bad is that on the spectrum? But I suppose it does vary a lot, I imagine.
So it sounds quite limited, really. And again, I think if he's not had that assessed and he's that limited with both pain and dysfunction, then I'd be advising him to get further assessment, really, and then hopefully some good management, really, to increase that range and reduce the pain.
Absolutely, yeah. Okay, so hopefully the info we've shared has helped, and hopefully you'll be able to get the right help and get that all loosening off. We've covered all the questions that have come in now. So was there anything else that you wanted to mention or talk about or anything before we finish, Phil?
No, I think that's everything, really. If you have got any further questions, obviously you can get in touch with me and I'll try to answer them, or I can ask my colleagues at the dental hospital to try and advise or whatever. Yeah.
Fantastic, thank you. Yeah, so if anyone else has any specific questions, if you email me, zoe@nass.co.uk, and I can pass those on to Phil. But hopefully we've covered most things in the session today. So thank you very much for joining us, Phil. That has been really interesting and good to try out a few tips and tricks as well.
Hopefully helpful. Okay.
Yeah, definitely. So for everyone watching, our next Facebook Live is going to be next Wednesday at 1 p.m. again, and I'll be running a session all about self-care techniques, so that all my top tips to fit in some self-care, particularly when you're busy through December as we're getting up towards Christmas. So hopefully lots of people will be able to join me for that. So thank you everyone for watching, and I will leave you to the rest of your Wednesday.
Right.
Thanks, Phil.